differently. So to move on to Carolyn Buckee, Dr. Buckee received her doctorate in philosophy from the University of Oxford. She worked at the Kenya Medical Research Institute, analyzing epidemiologic aspects of malaria, and went on to apply some of the theoretical approaches to understand malaria evolution and ecology at the Santa Fe Institute. She joined Harvard School of Public Health in 2010 as assistant professor of epidemiology and quickly rose the rank to associate professor in 2017. In 2013, 10 years ago, Dr. Buckee was named the associate director of the Center for Communicable Diseases Dynamics. Her lab uses mathematical models and data science to understand the mechanism driving the spread of infectious diseases with a focus on pathogen. She's received many awards. She is named one of the MIT Tech Review 35 Innovators, a CNS Top 10 Thinker, a Foreign Policy Magazine Global Thinker. She has published her words in many journals, and she's been on a lot of public media, including CNN, The New Scientist, NPR, ABC. Carolyn, it's a great pleasure to have you with us virtually today, but we hope in person in the future to talk to us about data science in crisis, leveraging data for humanitarian disaster response. The floor is yours.
Thank you so much for having me. I'm sorry that I can't be with you today, but I hope that we can have a good discussion. I'm going to share my screen. Let me know if that works. Do you see my screen? Yes. And the sound is okay. I will go ahead and assume it's okay. So today I'm going to talk about the use of new data streams in humanitarian disasters. But I'm an infectious disease epidemiologist by training, and I've mostly worked in disease surveillance using new data streams from pathogen genomics all the way through to tech data in the context of malaria control, dengue outbreaks, trying to understand how we can get better data to policymakers. So here's an infectious disease example. This is a heat map showing the distribution of malaria cases in Cambodia. And what you can see is that we have a heterogeneous distribution around the country. We have a high burden of disease here on the border. We have some second area that has a moderate number of cases, as well as this middle area. And what the Ministry of Health and the National Control Program needs to understand is, are the cases in the middle imported? Is this second area simply spillover from the high burden of disease on the border? How much cross-border malaria is there? And the reason that's important is because to allocate resources for endemic diseases like malaria requires a suite of different commodities as well as treatment and different handling of different data. In this case, because malaria is a vector-borne disease, so we may want to deal with local transmission differently than with imported cases. And so in that context, this resource allocation question has led to much of my research, which is about mobility and migration. And that has led naturally onto some of the work on natural disasters. And just to set the scene in terms of data, from an epidemiological surveillance perspective, many public health decisions actually come down to case counts, obviously, how many cases of whatever the condition is, and critically denominators. What is the population at risk? Who is impacted? What are their vulnerabilities? And these are essential in order to make these resource allocation decisions. So that's where a lot of my work in terms of methodologies and thinking about new data streams come from, and especially around migration and displacement. Cross-border migration is something that we are going to see large increases in the future, especially in the context of climate change and conflict. So my work kind of ended up coming into the humanitarian disaster response space because often these same data sets and same tools are required in the context of disasters. So these two schematics just show how natural hazards and armed conflicts can both lead to population displacements, ultimately disease outbreaks, which is still one of my foci in terms of my work, but also many other challenges that are directly associated with health vulnerabilities among populations that are forced to move. And something that's a little bit different in the context of disasters is that there may be different needs in terms of the aids and interventions. So often you need basic shelter, water, sanitation, and hygiene, as well as thinking about outbreak risk. Disasters tend to occur on an acute timescale, although the chronic effects of disasters, of course, have many different needs. But what that means is that there is an urgency around data sharing, there is an urgency around the analytics that need to happen, and the iteration between data and translation of that data into actionable insights. And then the last thing is that often displaced populations are particularly vulnerable. That's not just in terms of poverty and immediate need for shelter, but also with respect to their health outcomes. And so you can imagine following the floods in Pakistan, yes, populations were vulnerable to things like dengue outbreaks, but anyone that was dependent on electricity for medical needs, anyone that required dialysis or cancer treatment becomes very difficult to look after in terms of healthcare. And so if you think about that same risk map in the context of Pakistan, so now we're looking at dengue cases from an epidemiological surveillance perspective, and we may get some case reports from clinics around a country saying that there are a certain number of dengue cases in different parts of the country, but this happened in the wake of the floods. And so this is a map that we delivered to partners there. If you look at population movements, the question is, what is the at-risk population? Are those imported cases? Are these people moving? Do they have other needs? This dengue outbreak is occurring against a backdrop of massive population flux, and we need to be able to understand that if we are to fully address their healthcare needs. So in terms of the actual data that we have to work with, the information about population movement has changed dramatically in the last 20 years. In the past, and I would say in most parts of the world, for most of these questions, we still rely on census data, on border crossing information, and on travel history surveys, which are often collected in the context of clinics, disease clinics. And if you think about the data sets that you have on a spatial scale on the x-axis from very local all the way up to international movements, and we think about mobility dynamics on a temporal scale from very quick movements all the way up to long-term migration, those data sets were imperfect, had their own nuances, but sat in these different parts of that spatial temporal spectrum. Now we have a whole host of sophisticated, complex data sets available, everything from individual traces from mobile phones, social media location data, anonymized mobile phone records, satellite information, Google location history data, and they now span the spectrum in terms of temporal scale and spatial scale. So we have this influx of data that's now available to try and understand things like population movements in the context of disasters. And my group's been working for a long time with these data sets, trying to understand how to use them, how to safely share them, what kinds of limitations they have, and so on. But there are many limitations, which I'm going to talk about. But in a sense, we now have globally distributed sensors that give us real-time data. It is biased and it is heterogeneous in terms of coverage, but it is a vast amount of information that can help us respond to some of the crises that we're going to face, especially as climate change worsens. So the two principal sources of data that we work with are data from mobile operators. Those are called call detail records, or CDRs. They are aggregated by the operator, and they essentially tell you the approximate location of a person when they use their SIM in the context of cell towers. So this picture just shows a sort of a map. The centroids of these Voronoi cells are supposed to indicate the cell tower, and as people use their phone and move around, we have a discrete time-stamped sense of where they are, and it's just approximate. With smartphones and social media, as you're probably all aware, we now get highly resolved continuous trace data. So in terms of the privacy implications, these data sets are quite different. They are regulated differently. The industry standards are different. And frankly, at the moment, it's a little bit of a wild west with this kind of data. I'm not going to talk about ad tech data, which is another type of smartphone data related to the ad tech industry. And I think that is one of the ones that is really wild west in terms of regulation and the way people are using it currently. Of course, representativeness is a major issue for these data sets. So in a given population, only some are going to have mobile phones. The mobile operator data can come from people with SIMs on a so-called dumb phone. Smartphone users are a subset of that, and app users an even smaller subset. So they're not representative unless you do some careful kind of calibration. And then, of course, they represent particular age groups disproportionately. And so children are missing, elderly are often missing, and the very poor are missing. And that's something to always keep in mind when anybody says that they're going to use big data. Who does this data represent? Who is missing? And so we've been working for a long time on the ethics and privacy of this, using differential privacy to try to establish standards and build analytical pipelines. I would say the methods are now pretty robust, but what we lack is buy-in from regulators and movement in terms of the legal frameworks that exist to protect people's privacy in the context of these data sets. I'm happy to talk more about that afterwards. But what can you do with these data? So this is a collaboration with Grameenphone in Bangladesh. This work was led by Aisha Mahmood. And what you're looking at is the movements around the country from about 64 million cell phone subscribers during Eid. So people would leave Dhaka, which is this spot in the center, and travel to family and so on, and then they'd come back at the end. So the heat map represents flow in and out of the capital, Dhaka. And this is millions of people. And so we can start to actually see how things like seasonal holidays, which we know drive many disease outbreaks, start to impact the spread of disease and our surveillance efforts. This is just a time series to show what this data looks like when you analyze it. So if you look at the proportion of subscribers leaving the city, this heat map here just is every district ranked from its distance from Dhaka, which is at the top. And you can see the weekly movement. So on the weekends, people leave the city. And these two stripe bars are Eid. And so then you can see that people travel quite long distances and come back as well. And so we have a lot of mixing. And we've looked at data like this from many parts of the world. And overwhelmingly, what we see is that people are traveling very long distances, much longer than we would predict from standard theory based on what are called gravity models in the field. So what can we do with this data in the context of outbreaks? The real key is trying to understand how to meaningfully combine this with metadata, which is essentially case data, information about the population and the health vulnerabilities there. And again, this is all about trying to establish what your at-risk population is and make sense of this very large data set that has inherent flaws. So in this case, what we did is we knew how many chikungunya cases there were in Dhaka. This chikungunya outbreak occurred during Eid, and the concern was that it occurred in Dhaka and people were going to spread it to the rest of the country. And the question was, how can we efficiently target surveillance resources to figure out where to look for chikungunya cases outside of Dhaka, given that there is not a robust surveillance system in the rest of the country. So we had this metadata, we did some modeling, and we were able to make predictions about when we thought cases would get to different parts of the country. This metadata is absolutely key. And I think when we talk about big data or data science approaches, the quality of the data that you have, the ways that you can link it with meaningful health data, is really one of the biggest challenges, because it does mean moving across silos and combining data in ways that are useful. And I think that's one of the big challenges that we have. In any case, in this study, we were able to help define which areas to expect cases in next. So there are many types of data streams. This is a comparison. After Hurricane Maria in Puerto Rico, many people left the island. And this is a comparison of these different kinds of data that we have on mobility and migration. Census data tends to be spaced far too far apart for acute crises to be useful. Flight data is okay, but it's only a certain type of information, and it's hard to infer actual numbers. Here you can see that the mobile phone data and data from Facebook, so this is smartphone users with Facebook on their phone, you get a much more dynamic picture. So this is the people leaving the island in the wake of Hurricane Maria now. So you can see that you can get a kind of more dynamic movement. Each data set is slightly different And so you can't use just one. You have to really think hard about how to combine these in sensible ways. The issue with these new data sources is that they all have different requirements with respect to privacy and regulation. They're all siloed within corporations. And so, not the census data, but mostly they are siloed within corporations. And that's a problem because at the moment, there is no mandate and no regulatory way that you can ensure that companies are sharing data. At the moment, a lot of these types of projects are done under the auspices of a data for good program. And that's fine, but it really occurs at the whim of the CEO of that company. And so if they decide to stop sharing data, they don't have to. And so I think this is something that we can talk about later, but I think this is a major problem when we think about the use of people's data to help people. We really have to get serious about what levers there are for companies to share. So during COVID-19, people were obviously very interested in the lockdowns and whether the lockdowns were working, whether people were moving around, what to expect. And there was a sort of growing understanding that this data is very important and very useful. Many policymakers wanted to make decisions that were more evidence-based, but they didn't have experience with these data sets and they didn't really know what questions to ask. So all of these, I don't know if any of you saw, but all of these, free mobility maps that came out, they were largely not very well tailored to policymakers' needs. They didn't really work on the scale that they needed to work on for decision making. And it was very confusing when the decision makers had so much on their plate to deal with. So we developed a network of researchers around the world to take this data, work with companies, we knew how to do it already, and make situation reports that we gave daily to mayors, chief information officers, governors' offices, and governments around the world. And I would say the key to this it was called the COVID-19 Mobility Data Network, which is not a very good name for anything. We've now turned that into a platform called Crisis Ready. And the thing that I really want to emphasize here is that there are 3 buckets of work that we think are important for the translation of data science in the context of disasters. First of all, the data, there may be a lot of data, but it's usually not generated for the purposes of public health. And so there is a lot of work that needs to be done in the context of companies to get that data ready into the right format. Then there are the methods to actually use the data safely and understand how they can be implemented in the context of a crisis. And then this third piece, which I think we always underestimate, is the importance of having a translational component that speaks to the specific needs of the local policymaker. Without that, it's very easy for people to think that big data is going to solve everything, but it won't unless it actually addresses the needs on the ground of a specific person who has to make a decision. And I think having local contextual knowledge and local contextual partners who are able to work iteratively with decision makers was key to making this successful. It's complicated because there are many things that have to be in place before a crisis hits: data sharing agreements, regulation, all of those things. The methods should be standardized, they should be transparent, and at the moment we're still trying to figure out how to do this well. And then I think that translational capacity is lacking globally because we continue to assume that data science and dashboards and things can be plonked down somewhere and used without a human interface. And that's just never going to be the case, in my opinion. So we've been working on this a lot, and I just want to say that one of the things that I think as a global community we need to come together around is this issue of ethics and equity in the use of new data streams for this kind of work. But I won't belabor it here because I'm sure you've talked about this a lot. At the moment, I think a lot of the work in translation of data from tech to disaster response or any kind of public health has this strange framework where it involves industry partners, academics, and then people who are in operations, whether that's NGOs or government. And the idea is that this data should help us improve decision-making. And I think that's a nice idea. And it only works in very specific situations, in my opinion. But at Crisis Ready, what we've started to do is focus on this one thing, which is mapping population displacement and working with humanitarian agencies, UN OCHA, World Food Programme, Red Cross, and other small-scale partners to help them understand the population dynamics in the wake of crises. So, for example, we produce disaster situation reports in partnership with local public health agencies when tornadoes hit, when there are storms, when there are wildfires. And it gets down to very local decisions like where should we send the fire trucks, or where should we put the Red Cross shelters for people escaping from a storm. So they're very practical questions in the end, even though there's all of this methodology and data science behind it. When the Ukraine crisis began, we worked with many agencies to try and understand where refugees were moving outside of Ukraine in order to guide their aid distribution. And you can be much more targeted in that way. And then, of course, when there was the earthquake in Turkey, we were working closely with humanitarian agencies there to understand where people were, the extent to which people had been displaced, where they were moving. We also worked in partnership with the Humanitarian Open Street Map, which I encourage you to look at their website too. It's really a wonderful resource and an example of crowdsource tech for good in this space. So I guess before I put this up there, so I think one of the things that we think about in data science is all the ways that we can bring data science to bear on the questions that we care about, and humanitarian disasters is one that I think everybody is interested in. We still have a long way to go in terms of making this a seamless transition. We talk about everyone's using big data to inform decisions, but I think when you get down to very specific local decision making, especially around crises, it's often not particularly high tech, and we're not using data as well as we could. And one of the reasons that this translational pipeline is difficult to develop is because at the moment, the frameworks don't exist for governance, for regulation and appropriate regulation in different settings. We don't have widely accepted standards for data aggregation and privacy, especially in the public sector. For the academics, we have to have data sharing agreements, legal agreements, we have to do ethical review, and all of these things take time. And then on the other end, there's still this question of like, okay, you can make the cleverest map in the world, but who's going to look at it, and what decision is it going to change by knowing that intelligence? And that, the humanitarian sector is its whole ecosystem. So trying to bring together all of these different stakeholders, keeping in mind the affected communities themselves, is an extremely challenging task at the moment. And I don't think there are so many examples of people doing it exceptionally well. I think there's a lot of work to be done here. In theory, data goes maybe through an academic partner and maybe goes to the operational person. Potentially, companies can just provide those insights to governments and NGOs directly. It's a very interesting political space right now. Yeah. So this is our team. And then I just want to end on a few notes about women. So I think all of you are aware of how male-dominated data science is. And I just want to show you, this is from the US, but I think it has applications elsewhere. This just shows the percentage of women in different academic courses from 1970 to 2010. And with the red line, the red horizontal line showing 50-50. And I want to highlight computer science here. So computer scientists, of course, originally, many of them were women because it was not viewed as a sort of intellectual space. So at Harvard, the original computer scientists were all women, paid badly and not respected particularly as number crunchers. The fraction of women increased until the 80s, and it's been thought that the aggressive marketing of personal computers to boys led to massive drop-off and a real change in the culture of computer science. And I think that this has direct repercussions for the data science landscape that we see now. If you look in the sciences, this is again in the US, but I think it's as bad or worse in other parts of the world. Computer sciences, engineering, and technology in particular are really underrepresented in women. And I'm sure all of you have had the experience of being the only girl at the table when you were younger, the only woman at the table in some of these discussions. And I really think that there needs to be significant cultural change. This is just a graph showing that the importance of media. So this is looking at films and television and thinking about our daughters and our younger women. We don't see ourselves represented. This is why this conference is so wonderful, but we often don't see ourselves represented, especially in engineering and computer science. So I think that I'll just give you my personal view. Data science is quite new as a field compared to other fields, and it has been dominated by computer science and the tech industry. And I think that this has had a very important negative impact on the culture with respect to women. So I often think that the big data movement, it often assumes that local and contextual knowledge is somehow less important than how big the data is and how clever your analytics are. And I actually think that this is a feminist issue, but it's just not the case that you can get around biases in the data. It's not the case that you don't need to know about the local and contextual situation in order to do translational work. So I think what has happened is that we have this hierarchy in our universities where physics and math and engineering and computer science are somehow cleverer than some of the more so-called soft sciences. And that has a gendered aspect. And so I think in data science, we have to be very careful not to always question when people talk about big data. My opinion is that the data for social good programs that exist have largely failed because of this hierarchical way of thinking about knowledge. And I guess my caution to everybody is that fancy looking simulations, people that say AI all the time and use opaque language are not always right. And we tend to assume that if you say AI, then you don't have to explain your methods well. And I just think that that is really problematic. So I think it's important to always ask what exactly the data are, who owns it, what are the biases, how useful is it? And I hope that we can change the culture of data science and think much more systematically about what we mean when we say that we're using data for good. So I will stop sharing, and I'm happy to take any questions.
Thank you very much, Dr. Buckee. This was really a very enlightening presentation. I really enjoyed the anatomy of disaster response and the three domains: readiness of data, methods readiness, and translational readiness, with a contextual element that you so eloquently outlined. I really think this is very inspiring, and I fully agree that data science should always be transparent and interpretable. This kind of opaque black box that is supposed to dazzle us is confusing and really actually ignites a lot of suspicion and lack of trust. So thank you so much for outlining this. I think we may have a question in the back. We need a microphone, and I'll repeat it for you so it's very clear. Yes?
Hello. Thank you very much. That was a fascinating talk. I was just wondering, in terms of data visualization in your work in spread of disease specifically, whether you've done studies on releasing visuals of the spread of disease as in terms of public information, and that affecting behavioral change.
Okay. So did you hear the question, Carolyn, or should I repeat it?
I did.
Okay.
So this, of course, came to the fore in the context of COVID, because there was so much interest in behavioral change. Until COVID, we had worked just directly with control programs to help them with their surveillance. And so we like only through publication would we share predictions. And I think we're still not at a place where real-time predictions about the spread of disease is something that it's very hard to do predictive modeling. We can definitely highlight which places we think are going to be most connected. In terms of behavior change, that behavior change, I think, is the final frontier of infectious disease control. we still really don't understand how people interact with data, how people understand their own risk, and what drives travel. So if you look at the lockdowns in India, for example, they were a disaster, but they weren't a disaster because people were trying to assess their risks. They were a disaster because people needed to feed their families and literally couldn't lock down, and they left because there were no jobs, and it was much more of a social economic issue. And so I think behavior change in the context of disease risk, we still really don't understand, and it's going to be very, very contextual. So no, we haven't looked at that. I think it would be very hard to design a study well that would be able to really quantify that and think about it carefully. But I'd be interested to see how. I haven't seen even any work about that. So yeah, it's an interesting question.
Thank you very much.
Any other questions? Yes, sir. We have a question over here. We need a mic quickly. Can we have 2 sets of mic? Or you can speak loudly and I can repeat.
I'm interested in the data readiness methods and the translational readiness that you spoke about. And do you have any like a best practice or an example besides the COVID that a country is adopting for, as contingency plans for disasters and otherwise nuclear attack or anything?
So we've been working with multiple partners to try to set up these frameworks. So specifically Mexico, Colombia, and Thailand. And for example, and actually across Central America, so many countries have a disaster response agency. In Mexico, our partner is Senapred. In the Central America, it's similar. So we are working with them, for example, to integrate data into their disaster simulations. Most countries do disaster simulations of some kind. And so we're trying to find ways to get data into those simulations. Many times then it's not well integrated. So I think there are specific ways to think about the use of data science and new data pipelines in that context. The other thing I would say is that we've been working on trying to find ways to enforce some kind of charter that mandates that companies share data in the wake of disasters. So there is precedent for this. So there's the International Space Charter, where satellite companies share data for some finite period of time, and then the data goes away after natural disasters like earthquakes and so on. And satellite companies are obliged to do this. Now, it's hard to enforce, but you could imagine a similar framework where companies, cell phone companies and so on, agree to aggregate, anonymize, and share their data for a fixed period of time. I think that would probably have more uptake in the business community compared to just open-ended requests for data. So I think there might be ways, and we're trying to work towards them. It's quite difficult to get the sort of governance and regulatory approvals and everything together in one place. But I think that eventually this will become a standard part of public health data. So it's just a question of seeing whether we can corral it sooner rather than later so that we can deal with some of these natural disasters better.
Thank you. Any other questions?
Yes, please.
Last question, yes?
Yeah. Regarding the modeling of the epidemic during Eid in Pakistan, I think, or Bangladesh, I'm not sure. Which kind of models were based on the available data? Which kind of models did you use? Are they agent-based, compartmental models? Did you use any kind of PDEs to simulate the movement of people between one region and another? And if we want to take into consideration the cultural factors that that may play a role in the epidemic, do you have anything in mind about the use of heterogeneous models compared to homogeneous compartmental models, etc.?
Yeah, so in that particular study, we used a compartmental framework. What we did was we fit the epidemic in Dhaka to an SEIR model quite simple. And then we had, then we knew the number of people leaving each small section of the city. And so then we used a kind of meta-population framework to estimate the probability that travelers were moving to different places. So we combined a very simple model with a kind of almost statistical analysis and a meta-population model. So it was ODE based, at least for the fit with the cases in Dhaka. And what I would say is that I'm often quite wary of large agent-based models because there are very, very many parameters to fit. And the more assumptions you have to make, the more you may be getting some of these local contextual pieces just completely wrong. And it's also very hard to evaluate model fit and reproduce and all of those sort of basic scientific tenets of modeling. So I tend to prefer more data, simpler models, and then a lot of human intervention. So making sure that as you develop the model, you're actually working with the dengue chikungunya control people, because they know, people in the clinics know what's happening. You can get so much rich information that can inform your model if you have the right stakeholders involved. So my opinion is I would always rather have local experts help me inform a simple model than a very complicated model, but I haven't spoken to anybody on the ground. So I don't know if that answers your question. But.
Yes, thank you.
Thank you. Fantastic. This is really, again, to enhance trustworthiness, transparency, reliability of your model. Thank you so much, Carolyn. We can go on, and I hope we get to see you in person. Thank you for a fantastic talk.
Thank you.
Thank you for being with us.